My name is George Louie, and I am the medical director of the Adult Congenital Heart Program at Stanford, a collaboration between Lucile Packard Children's Hospital and Stanford Healthcare. We have one of the largest surgical volumes in the United States in individuals with congenital heart disease. We perform well over 1,000 cardiac surgical procedures per year across the Stanford Children's Network. Outcomes are greater than 97.5% survival over the last 3 years. We also have one of the largest top 10 surgical volumes in adults with congenital heart disease, performing well over 100, 120 surgeries per year in adults with congenital heart disease. Their survival is almost 99%.
People think about heart disease, and most of us think about heart disease in grown-ups. And that's disease that develops over our lifetime. And it's critically important for all of us to take care of our hearts, to take care of our bodies. And we know, don't smoke, exercise, maintain a healthy diet. And those are critically important. Most of the patients that we take care of in pediatric cardiology and then in our adult congenital heart program are individuals who are born with a heart defect. And it's nothing that they did or their parents did. This is a malformation that occurred, and it's our job to make up for that, to help the individual live with that or to fix it. Now, during that lifetime, the person also has to take care of their heart in every other way. But it's a different kind of a problem than the problem that develops in adults. And it's why we have a specialized program for congenital heart disease. Most babies and children with a congenital heart defect don't have any symptoms. Pain is not a feature of having a congenital heart problem. Some of the babies, when they're born, have low oxygen saturations and may be blue at birth. But most of those children feel good. Most of them don't have any symptoms. Sometimes we see slow growth. And in a child, growing is their main job. So if they're not growing well, then there's a problem. Symptoms due to a congenital heart defect are fairly rare. And that's quite different for individuals who develop a heart problem during older life, who develop coronary artery disease or heart muscle disease. They usually have chest pain or breathlessness with exertion or problems doing their daily activities. It's really not the case for most of our patients with congenital heart defects. And even though the problem may seem severe, the children and the babies usually feel fine and do well, which also makes our job much easier and makes it easier for the parents to know that those kids aren't suffering. I've been asked about how do you treat these defects once we find them? We have very powerful techniques to diagnose heart defects. And the treatment really depends on the specific problem that the baby or child or grown-up has for that matter. Some defects are so minor that we may not need to treat them at all. However, it would be a mistake to say that they get cured for the most part. The patient individual still has that potential problem. So we follow those patients the rest of their lives, those individuals. But we may not have to intervene. We may not have to operate on some of those simple cases. On the other end of the spectrum, there are babies who are born who we stabilize. We can keep them stable and alive, but we know we must intervene soon, either in the first days or weeks after they're born, in order to save their lives and allow them to be safe and stable to go home. In between, the babies who must undergo an operation before they leave the hospital, and those people that don't necessarily need any treatment, we have a large group of patients who we know the problems that can arise. We follow them closely. We keep that continuity with them. We use our tools, and we work with them knowing if something happens, then that will lead us to recommend a surgery or an interventional procedure. Or if it doesn't, then we'll wait and continue to watch them. Parents always ask, what will my child be able to do? The answer is we don't always know. And there's a range of possible outcomes for every individual. And some of it gets down philosophical about what do you want to do? But our goal is to have everybody live as full a life as possible. I want the best possible quality of life for my patients. We generally do try not to restrict children's activities. If their heart condition is such that it doesn't allow them to be a kid, then we need to do everything we can to fix or repair the heart in such a way they can be a kid. When I'm talking to teenagers and parents of teenagers, we have to start talking about what's life going to be like as an adult with congenital heart disease or a congenital heart defect. And, truthfully, in many ways, a 25-year-old is not that much different than a 15-year-old. But a 25-year-old woman who is now married and wants to have a family is quite different. And so things start changing at the beginning of adulthood, primarily around childbearing. And that's an important thing. And that's a feature of our adult congenital heart program that's highly successful. But I think for our patients who get into middle age, the heart behaves differently when you already had a congenital heart defect. And I think that that's when the skill of a physician trained in internal medicine who recognizes heart disease that may be acquired on top of your congenital defect, who recognizes the changes with age that come in the heart and the conduction system. More adults have high blood pressure, so that has an impact on someone who already has a heart defect. So I think what happens is that you really layer on top of a heart that may not be completely normal, one that we repaired and is functioning well, but may not be normal, and layer on top of that acquired heart disease, age, high blood pressure, and other things. That then makes for a more challenging situation that requires a strong medical team, a really alert medical team, and a real attention to how can we help you and your heart manage this new situation. Stay in care. That is absolutely the number one thing, because you can't know if something's not going well over a period of time, but we can. And we have early warning. We can help you. So staying in care is number one. Number two is to take care of yourself in every other way. And I'm talking about physically staying in shape, not smoking, keeping your weight under control, healthy eating, healthy lifestyle, et cetera. But I'm also talking about emotionally. We know that many individuals who grow up with a childhood problem are faced with mental health challenges, are faced with mood disorders. And frankly, that's something that needs to be cared for as well. Sometimes we've noticed that because we've done a great job and our patient is feeling good and doing well, the parents might wonder, why should I keep going back to see the heart doctor? Why should I keep going to see the pediatric cardiologist? And we know statistics show us that many patients, starting at the age of about 10 or 11 or 12, their regular visits to the cardiologist start dropping off. And when they get to adulthood, the number of people who are actually lost to follow-up, they don't go on a regular basis to meet with a cardiologist, that number is large. And that number is worrisome because you can't tell and your child can't tell if something is changing inside of their heart. And that's at the age of 10 and 12 and 22 and 32. And yet if we wait for something to go wrong, that's very late. And frequently we could have done something sooner, something less dramatic if we'd known earlier. So the beauty of having a program at Stanford where care for the child and the adolescent is coupled with care for the adult in the adult congenital heart clinic, there's no reason to interrupt that care. And I would just say to parents out there, your responsibility is to make sure that your child, even though they're fixed, even though they feel well, goes back for their regular evaluations.
We want to be able to provide care throughout the continuum of your life. This also holds true for many of our women with congenital heart disease who now are surviving to their adult years and are thinking about expanding their family, having children. And that becomes really important for them to seek a cardiologist who knows how to take care of them during their pregnancy and afterwards through labor and delivery. And we have that here at Stanford with the Johnson Center. Not only are we doing that at the Johnson Center, but all throughout Lucile Packard Children's Hospital. We coordinate care for patients with congenital heart disease all across the Bay Area, Northern California, and provide some of the most complex care to patients all across the United States. Patients often seek care for a second opinion by sending in their cardiology notes, echocardiograms, imaging, and we will review them here in a multidisciplinary conference in order to provide a second opinion. The advent of telehealth has allowed us to provide these types of consultations through the video and provide them all across the United States. And we'll have even cardiologists reaching out for these types of consultations. And we'll do it together as a collaborative care with the primary cardiologist locally.
Patients sometimes ask me, how can I tell if my doctor is the right doctor for me? And I would say, I'd answer, ask them how many patients with your diagnosis they currently are caring for. I can guarantee you that in any patient group here, our doctors, our caregivers have dozens and dozens of people with your condition, and they've seen this over years and decades. So we have a wide range of experience in the team, taking care of a wide range of patients. We have a multidisciplinary program. That means that we have experts in surgery and anesthesia and radiology and cardiology and electrocardiology and fetal cardiology and other specialties all working together. There's no boxes unchecked. There's no gaps in the program.
The Adult Congenital Heart Program here at Stanford has been here for over 20 years. The experience is why people come to Stanford. We have so many patients who have seen multiple cardiologists all across the area, and then they choose to come to Stanford because of the combined expertise of our pediatric cardiologists, our cardiac surgeons, our adult congenital heart team that perform well over 1,000 operations a year. Our clinics take care of over 1,500 patients per year with congenital heart disease. We're ranked nationally by the US News and World Report in cardiology and heart surgery. It's really important to have the collaboration between our pediatric and adult providers in order to ensure the best quality of care in adult congenital heart disease.
Our program for adults with congenital heart disease here at Stanford is one of the best, if not the best in the country. It combines an adult hospital with excellent results with one of the top children's hospitals in the country. It involves individuals who are trained in congenital heart disease from babies to grown-ups to older people. It is the place where we train the next generation of people in this field. It's the place where we do research to discover the new treatments for conditions of the heart. So I can't imagine a program where you get all of that together in one place, under one roof, with a collaborative spirit specifically aimed at the population of people who were born with a congenital heart defect.